So retinoids in general are irritating to the skin. They can cause redness, dryness, peeling. So the higher concentrations definitely are more likely to cause irritation. I think it's really important to find the right balance of effectiveness, but also tolerability. There's really no point in, using the strongest tretinoin 0.1% if, you're going to be peeling 3 weeks out of the month.
Hi, skin friend. I am so glad you tuned in for this week's episode of the Skin Rail. This week, I am talking about one of my absolute favorite skincare products. Besides sunscreen, this is my go-to, one of the ingredients I really think most everyone who is an adult should incorporate into their skincare routine for beautiful skin for the rest of their lives. I love it so much. And I am talking about retinoids. Retinoids are the prescription version of retinols, which are the over-counter version. And they do so many wonderful things. We have such great data to show how it boosts collagen. It can help improve fine lines and wrinkles. It can help improve acne. It can help with cell turnover. It does so many wonderful things. I'm so glad to be joined by my colleague and board-certified dermatologist, Dr. Caroline Chang. I know Dr. Chang from back when we were both residents in Boston. So we go way back, but she is the founder of Rhode Island Dermatology Institute, which is Rhode Island's very first direct care dermatology practice, where she puts the patient relationship first. No more insurance getting in the middle, no more middleman, and really just bringing medicine back to what it used to be. And of course, as dermatologists, we get asked all the time about how do I make my skin look better? What do I really need in my skincare regimen? And almost universally, I think dermatologists say retinoids. So if you have ever thought, maybe I need to incorporate that into my skincare, or maybe you've tried it and you have a lot of irritation and you're wondering, how can I actually do this and get the benefits? You're definitely going to want to stick around for this episode. Dr. Chang, thank you so much for being here to talk about one of my favorite skincare products, and I think yours as well, all about retinols and retinoids.
Yeah, thank you. I'm so excited to be here. It's one of my favorite topics and something that I talk about with my patients on a daily basis.
Yes, absolutely. It's something I use, and I'm sure you do too, right? This is something we're not just saying do it, we actually use it ourselves.
Absolutely. Yeah, I think my line is every dermatologist uses it, so you should too. So it's definitely an important part of everyone's skincare routine. And I'm excited to dive into it and explain why it's so important and why we should use it.
Yeah, so let's just break it down because I think sometimes the names get confusing, right? You hear retinol, retinoid, tretinoin, retin-A. What do all these things mean? Are they the same or different or what?
Yeah, so retinoids are a family of products or ingredients that are derived from vitamin A. And what they do is they break down into different compounds, all the way to from retinol to tretinoin. And tretinoin is sort of like, I guess, the most active and closest ingredient that gets absorbed into the skin. So, different names that you might see over the counter, you'll see retinol and retinaldehyde are all both different ingredients that are available over the counter. And by prescription, most commonly used is tretinoin for anti-aging effects. Tretinoin is the generic name, and there are branded versions of it that have different names. And Retin-A was one of the, I guess, the first ones out there. So we do tend to refer to it as Retin-A because many people know that name, but it now has many other companies have branded different subtypes of tretinoin. And so there's a lot of names out there, but basic ingredient would be called tretinoin.
Yeah, exactly. It can get confusing. The retinoids are the prescription ones. They are stronger. So you might say, well, why wouldn't everyone just want the stronger one, right? Isn't that better to use the stronger one?
Yeah, I mean, there's always that push to use the stronger one, the highest concentration one. Tretinoin comes by prescription in three different concentrations: 0.025, 0.05, and zero point 0.1. And often patients are really eager to push to the highest and strongest level. Higher concentrations, while they do apply more product to your skin or more active ingredient, they are more irritating. So retinoids in general are irritating to the skin. They can cause redness, dryness, peeling. So the higher concentrations definitely are more likely to cause irritation. I think it's really important to find the right balance of effectiveness, but also tolerability. There's really no point in, using the strongest tretinoin 0.1% if, you're going to be peeling 3 weeks out of the month and red and irritated.
Or not even using it.
Exactly.
Sometimes I had to back down. I used to even use tazarotene, so throwing out yet another type out there that's even stronger. I used to be able to use that without any problem, but then my skin just got too dry. And yeah, then I wasn't using anything for a minute there. So it's not always better to go like harder, blast it, because then you may not actually use it and then you don't get the benefits.
Absolutely. And just mentioning tazarotene, I want to swing back to the different retinols available. There's also the well-known adapalene, which kind of gets forgotten. It used to be prescription, now it's over the counter. So it's kind of in that middle ground. So adapalene is another retinol version that was a prescription. Now it's over the counter. And that one is also another good option. I think more for acne prone skin, but I do that throwing that out there, as well as tazarotene or Tazarac, which is a even higher potency in the irritation category for sure of a retinoid that some people are able to tolerate and use for anti-aging, but I would think reserved more for acne cases.
Yeah, I don't know why adapalene, I do forget about it. It's true, but I do think it's a great alternative for someone who has maybe tried the over the counter, wants something with a little more bang for their buck, but just can't tolerate the prescription strength. I think it's a good one to try, because I do find it's a little less irritating. People can tolerate it a little bit better. So yeah, I need to remember not to forget that one.
And getting back to tolerability, yeah, if one of the biggest concerns that I have when I prescribe a retinol or a tretinoin is that it's going to cause irritation, and then the patient's going to stop using it. They're going, oh, this stinks. I got a rash. I'm not using it. So, really, really important to counsel and to guide, your patient, and that of what the side effects are, how to manage them, which would be basically stopping any other irritating product, only using tretinoin, kind of getting that into your routine, getting your skin used to it. And then from there, moving on to higher strengths if you can tolerate it.
Yeah, absolutely. I want to definitely get into best practices of how to actually incorporate it in a little bit, but let's also just talk about, why do we love it as dermatologists? Like, what does this magical cream do that makes all of us want to use it and recommend it?
Yeah, so I mean, tretinoin is able to enter your skin. It's one of the few, sort of topical ingredients that actually can enter your skin, like actually goes into the cell's nucleus. And it actually teaches your skin to divide normally. So it affects cell differentiation. The easiest way I explain it is, if your skin is too thick, it makes it thinner. If it's too thin, it makes it thicker. It's sort of just, if you're not shedding skin quickly enough, it will help turn over skin. If you are shedding skin too quickly, it will slow that down. So it kind of just brings your skin cells back to baseline, whatever that may be, and just gets it, sort of like reboots your skin to sort of normal level.
Yeah, and sometimes I'll hear people online, they'll say, "Oh, it thins your skin," but it's really thickening your epidermis and dermis with collagen and improving that, but it's thinning out the top layer called the stratum corneum, which are really like dead skin cells that need to be sloughed off, right? So it does so many great things, but it doesn't thin your skin in a bad way at all. It's increasing cell turnover of those dead skin cells that need to be sloughed off. And it's great for acne too, because it unclogs those pores where you've got that oil and those skin cells that are kind of sticky, and it helps open up and unblock those comedones, which are sort of the root of acne. So it does so many amazing things. I think it's great for hyperpigmentation too, evening out skin tone, collagen boosting.
It's the do-it-all cream and our ingredient. And I always recommend, like, the number one skincare product that if you're going to use one, will be retinol at night, and of course sunscreen in the morning. Because I mean, if you have those two things, that's really all you need if you're a minimalist. Of course, you can add other active ingredients to your routine, but it's all just frosting on the cake. You really need the basics, which is a retinoid and a sunscreen. It helps with fine lines, improves skin tone, texture. it reprograms your cells to basically bring it back, sort of anti-age your cells to create more youthful cells.
I hesitate to say like a cream is such a miracle, but really sunscreen is. I mean, sunscreen helps protect our skin from UV damage, which contributes so much to the aging effects we see in the skin. And then tretinoin is like I think you've said before, like your daily vitamin for your skin, like taking a multivitamin. And the two of them together, really, that can get you 90% of the way and keep your skin looking great. I will say it takes a long time, like it's slow. I've been using it since I had acne and decades, really. And it took me, I feel like, a year before I looked in the mirror and saw the anti aging benefits of it, where my skin just looked more even and I felt like it plumper looking, all the benefits we want. But yeah, like I feel like it took me a year to actually see that.
Yeah, it's so true. I always say like you almost can't see the effects because they happen slowly and they're subtle unless maybe you stop the cream. And once you stop, about a month or so later, sort of look at your skin and go, "Oh my God, what happened? I aged a lot and my skin looks dull." And at that point, you might, head to your dermatologist and say, I don't know what to do, but is there something I can do to help? And then through that conversation, it might have come out that you were using, a retinol or retinoid, and then you stopped, and then at that point it's an aha moment where we say, "Okay, well, actually, I think now you realize what the retinol was doing."
Yes.
It's not a facelift, it's not instant, but what it's doing is slowly and steadily, kind of like taking a daily multivitamin. You just take it. You don't take a multivitamin and wake up the next day and you're like, "Woohoo, I feel like, Superman." You just take it because you know that it's day to day helping you regulate your system.
And it keeps your skin, I feel like your skin integrity better for longer. So if you have a chemical peel, if you have a laser treatment, if you have a facelift or surgery, your skin is going to heal better because you've been taking care of it. It has more collagen. It'll just make all those other things better too if you want to do them down the road. But it's not a facelift. It's not like cutting out skin, but it's a great, I like you said, just daily practiced along with your sunscreen. And I say it's like working out. When you first start working out, right? At least for me, it's not fun. You're sore and you feel like you're doing all this work and you're like, where are the benefits? I don't see the definition yet, but you have to stick with it, right? And it's all about consistency. And that is really hard for a lot of people when you don't see those instant results. But if you are consistent with it, it really will pay off.
Absolutely. I love that analogy. I may start using that. I'll give you credit.
That's right. Please do. Well, I'm going to say it's a daily vitamin. I love it. It's your daily vitamin A.
Just take it.
That's right. Exactly. What about people? Well, actually, before we jump into like best practices, is over the counter even worth it? And I'll say I get a lot. What over the counter retinol should I use? And I have trouble answering that question because I don't really know what the concentration is in different products. So I can name some that patients have tried or I've tried that seem good, but I do find it's a little confusing because I don't know what concentration is in what for the most part.
I mean, it is hard to find in over-the-counter products. It's a little less regulated on how the labeling is. So concentration is a little difficult. There are some lines that might have 5x, 10x, something like that. And in those cases, I think it's a better guide for giving you concentrations. I think we both agree that, if you can tolerate tretinoin, then get it because it's coming from a manufacturer where the product is standardized, the concentration, etc. But, some people can't tolerate tretinoin for whatever reason. They just can't. So retinol is a reasonable alternative. It's less irritating. It does work the same, but not as quickly and maybe not as fully as tretinoin. So, a little tip is that if you are not sure about the concentration, check the ingredient list. Ingredient lists are often listed by what's the highest concentration of the product to the lowest. So if you see retinol at the you know, last line or the last item, then it's pretty low. You want to make sure it's a little bit higher up on that list to make sure that you're getting, a decent concentration of it. And again, there's always adapalene, which does come in two concentrations as well, that if you're concerned that you're not sure about over the counter retinol.
Great advice there. Because I know people listening are probably in the childbearing years. Some people I know, I went through this when I had my kids, and I'm sure you did too. Is it safe to be on it, a retinol or retinoid, when you're pregnant or breastfeeding? What are dermatologists saying to people, to women?
Yeah, I think the general rule of thumb is if you are pregnant and you were using tretinoin, you should stop it, or any kind of retinoid, you should stop it. If you're trying to get pregnant or you're, of childbearing age in general, it's okay to use. But should you find out that you are pregnant, you should stop it. There are no studies that have conclusively determined that tretinoin use during pregnancy is safe or not safe because there are no studies that are available. There's no study designed for that.
And they're never going
They're
to.
never going to do it. So it is pregnancy category C, which means we just don't know. And so at that point, I think you do have to, have that discussion with the mother who, is pregnant, and give them all the information. And the general rule, as I think most of us and our colleagues would say, is if you are pregnant, stop it. Switch to safe alternatives that you can use to keep your skin healthy and exfoliated during your pregnancy. And then as far as breastfeeding, I believe it's also still an unknown category. Most of my patients, this really doesn't come up as a question until they are at a point they're at a point where they're able to come in the office, and usually their child is no longer nursing or they're not nursing as much. So at that point, I do think you just discuss the safety concerns with your patient, and it's a decision the mother and has to make based on the information given. So generally, I wouldn't recommend it. I would say just wait until you're done nursing, which hopefully isn't a long time.
Most moms aren't popping in the dermatologist like 1 month postpartum, right? It takes a minute to get your bearings, get your head above water. I totally agree with you. Like, if you find out you're pregnant, best to stop using it. There are safe alternatives. If you're struggling with acne, azelaic acid works great, glycolic acid peels. There are other safer things that we can use. And I'm generally okay with using it. If you're breastfeeding, especially the moms who are breastfeeding, like, they're 12-month-old or they're significantly farther out, just make sure your baby isn't putting their mouth on your face after you used it, let it dry, things like that. But in general, yeah, it's category C. We just don't know, but we do know about tazarotene, which is category X. So you definitely do not want to be using that when you're pregnant. So make sure you for sure avoid that one. What about Bakuchiol, right? I hear this all the time that it's a safe alternative to retinols and retinoids during pregnancy. Is that really true? Do we really know that?
Yeah. So Bakuchiol is basically a ingredient derived from a plant, from the seed of a plant, and as many natural botanical ingredients they do have some benefits when applied to the skin. I would say that Bakuchiol, as far as safety and effectiveness, the only studies that have been done are generally very small studies. So we don't have sort of as much proof as, let's say, tretinoin, that it is effective in the same way that tretinoin is. And again, as far as safety, there are no studies that determine or decide safety in pregnant women. So I would say it sort of falls into the same category as tretinoin. However, because it's an over-the-counter product and it's a plant-derived product, is generally considered safe to use as a safe alternative for tretinoin. But, if you really think about it, the safety is not clear.
We don't really have data to say yes or no, right? But I think people feel safer because it's coming from a plant and potentially not as strong as prescription strength. So yeah, I totally agree. It's probably a little premature to say, oh yeah, it's totally safe, but it has been shown to have very similar effects to retinols. So feel free to give it a try if you want something natural. Although I would say tretinoin is very natural. I mean, retinoic acid, this is from carrots, from food. From vitamin A. Let's break down, how should someone start using, let's just do tretinoin, right? Like, they want to start using it and they've never used it before. What are some of your pearls for someone starting out or someone who's on it but having irritation?
Yeah. So, really common question. The first thing I would do is discuss what other skincare products they're using. And I would say what you want to do is put aside any acids that you have, pretty much any active ingredient put aside for now. You're going to start with a very basic regimen nightly of washing your face, drying your face, applying the tretinoin, but you want a little pea-sized amount. So you're just going to like put a little dot, and then you're just going to dot like that, and then rub it in. And you can do a couple dots on your neck, which I do. And as I learned, you can put a couple dots on your hands, which you had mentioned earlier to me. And I love that idea. And then just rub everything in and follow with a good moisturizer, not something oil-free, not something light. You want a nice moisturizer, and just moisturize everywhere, neck, hands, everywhere that you applied it. If you are having particular areas that are dry, for most people, they tend to get dry around here. Combat that dryness before it comes by putting even plain Vaseline on those areas. And ideally, you want to use the product every night. But if you're having dryness or irritation, then you can start with every other night and work your way up to nightly. Most important is if you're using a product only once or twice a week, it's not really working the way you want it to. So that might mean that you need to bump down to a less aggressive or a less potent product, because it's not really doing what you want. I mean, again, it's just like it's your daily vitamin. If you take your vitamins twice a week, it really is not giving you that full effect. And so if you're having an irritation, sometimes we just have moments where we have a peel explosion, maybe once a month, where like you just get a retinol peel explosion where you just peely everywhere. Take a couple days off. It's okay. Just get over the peeling and then restart. And that's okay as well.
I didn't know there was a name for that, but I totally relate to that. Yeah, I'll be like, whoa, I guess I need to slow it down a little bit and take a night off and take a break. But yeah, super great tips. I love that you said really stop everything else. This is where I think people get into a lot of trouble, because they'll be using tretinoin and then they're exfoliating and then they're using something else and they're using all these things that by themselves would be okay. But when you use them all together, they just cause a ton of irritation. So yeah, really at night, this can be it. You don't need to do other things. And you don't need to exfoliate. I mean, people ask me, "Oh, should I exfoliate?" And I'm thinking to myself, "Well, my tretinoin exfoliates me enough, but if you are going to exfoliate one night, then don't use your tretinoin," is what I'd recommend. So don't be doing tons of different things, because you 100% will get irritation. And even, veterans like us who've been using it for decades, right? We still get a little peely and irritation. And then we know, hey, back off, bump up the moisturizer, avoid that area, and don't quit. Just, take a break from that section.
You have to know your skin, and everyone's skin is different, and everyone's going to respond differently. But what we do know for sure is that if you apply too many topical irritants, you're going to get a rash. So take it easy. Once you've got the retinol, your skin is used to the retinol, then you can, figure out how to add in some of your other products slowly. Add in one every couple weeks to make sure everything is good. You don't have any issues. And if you want to do exfoliation once a week, twice a week, depending on how oily, if you have oily skin, you might be able to tolerate more. But just kind of figuring that out at home in real time is going to be the most important.
Yeah. Are there other things you should avoid, like procedures? I know sometimes in the past we'd say isotretinoin, which is the oral version, to avoid certain things. Do you tell people to avoid anything when they're on it?
The biggest one, which is, it's a great way to sort of keep your skin healthy as well, is avoid picking your skin. Because the tretinoin makes your skin like baby skin, you're more sensitive and more easy to irritate or damage the skin. So if you are trying to squeeze or pop things, you might even scrape off some of your skin. Your skin's more prone to irritation and damage. So don't pick. Let the tretinoin do its thing. And I always tell people, find something to do with your hands, find another hobby. If picking is your hobby, then just, pick up knitting.
That's
And,
right.
learn the piano. Do something else with your hands and don't pick at your skin would be a really important one with tretinoin. Definitely, if you're going to do something like waxing, that does tend to, it's kind of the same as picking. Any kind of trauma or irritation that you're inducing on your skin, you want to avoid your tretinoin for, a few days before, to just basically harden your skin to that trauma. And most importantly, And when you're using tretinoin, you should also be using sunscreen. As you had mentioned earlier, the tretinoin is exfoliating that top layer, the stratum corneum. It's removing those layers of dead skin. So the sun and UV light is able to affect your skin more intensely, and you're more likely to get burned. So wearing your sunscreen is also important.
Yeah, of course. And if you're using this for anti-aging or to help keep your skin looking youthful, right? Wearing sunscreen is a huge part of that. So they really go hand in hand. Sunscreen in the morning, your tretinoin at night. You kind of touched on this, right? But one of the myths I hear about tretinoin or retinoids, right, is that, you can't be out in the sun. And some people will even tell me, oh, I can't use it in the summer, which I'm like, no, the summer's the best time to use it because of the humidity, and usually people can tolerate it a lot better. So, what do you say to that?
I think that the myth stems from what we just talked about, which is that your skin is like baby skin and it's more sensitive. But the myth has blown, morphed into this idea that you cannot use tretinoin in the summer. The thing is, tretinoin does not like combust with the sun and cause, horrible rashes. What actually, in fact, tretinoin, when it hits sunlight, it deactivates. Which is why if you get bottles of tretinoin, they're not in clear bottles. They have to be in closed containers. And that's also why we tell people to use tretinoin at night. So if you were to apply tretinoin in the morning and go out in the sun, it becomes inactive. So it really doesn't do anything if you use it in the summertime. But your skin is more like baby skin, and you wouldn't put your baby out in the sun without putting sunscreen on because they are more likely to burn. And that isn't that the goal. We just want baby skin.
Right. Oh my gosh, I wish I could, yeah, go back to that for sure.
Yeah, so if you have baby skin, then you got to treat it like baby skin, and so that's where that myth I think comes from. But I always encourage my patients to continue using it all year round. In fact, winter would be the time that you might want to back off, use it every other night, just because it's so dry, depending on where you are. But up in here in New England, it's dry. So you might need to reduce the number of times you use tretinoin. You also might need to increase the moisturizing, the moisturizer that you're using, use a heavier moisturizer as well.
Or go down on the strength, right? Like maybe that's when you use adapalene or over the counter if the prescription strength is too irritating.
Absolutely. You got to change all your products. Often you change your products from winter to summer. So why not change your retinol version as well? Depending on the season. The goal is not to have irritated skin or red skin. The goal is to have your skin look really healthy. So it's okay to change your products and go to less harsh products in the winter should you need that.
Yeah, and you may also notice as you get older, things change, right? I used to not need to use a moisturizer with it. Now I do for sure. Or I get that, what do you call it, retinol explosion or peeling explosion. Yeah.
Yeah, the peel explosion.
Yeah. So don't think you can't change it. You can't modify it. You can't adjust it. Are there any areas you recommend not using a retinol or retinoid? Because, there are body ones now. And sometimes I wish I could just soak myself in my prescription strength, but that's not really realistic. So what do you think about body retinols, retinoids, stuff like that?
Yeah, I mean, I think, skin is skin and skin likes retinols. So the thing about using products in your body is that tretinoin is generally packaged in size for use on the face. It's a small amount and it's going to be hard to apply everywhere.
Yeah. Ask me how I know.
You'll run through the tube so fast, and to have a body version of like a retinol, it can't hurt. Is it going to reverse time? I mean, maybe not, but it can't hurt to use it. And it's just like, low grade vitamin for your skin. Great. I would say you can use it anywhere, but you have to be very cautious in certain areas and really make sure you have a moisturizer on board. Areas that I would say are more sensitive would be the neck skin and also like under the eyes. So, you don't apply the retinol like eye cream and smear it there. You're going to get a rash. So just to be cautious about certain sensitive areas and to moisturize no matter where you apply it. But I mean, I guess skin is skin. So bathe in it, I guess.
At a minimum, right? It's just good to moisturize your skin. So moisturized skin always looks better anyway. So what the heck, get one with the retinol in it too. But Yeah, I do find my neck is really sensitive, right? The skin on our neck is thin. Same with the eye. I don't put it on my upper eyelids. I think that's just really asking for trouble for me. But yeah, my neck, I notice I can't use it as often just because it does get more irritated. So that's a common area.
Yeah. Yeah, just be careful. But yeah, I guess yeah, if it helps you moisturize, if that's the impetus to get you to moisturize, then throw it in there.
Yeah, I forget that too. I hop out of the shower. I'm so cold. I just want to like put my clothes on and I'm worried about moisturizing. But yeah, it's just moisturize in general will help your skin look better. So I think we covered most of the myths about retinols and retinoids. But I guess, can you just leave the listeners with like your top three pearls for someone thinking about starting or wanting to use a retinol or retinoid?
Yeah, so top 3 things I would tell anyone who is starting a retinol or retinoid would be, number 1 is, set aside all your other skincare products, don't throw them away. You may still find a role for them, but, set them aside to start. Start slow, so whether it's every other night or what even once a week is that, just start slow because you really want to love this product and use it. And if you have a bad reaction and bad experience with it, you're not going to want to use it. So we want you to love it. Start slow and use a small amount. Applying more does not make it better. This will not give you a faster result.
Yeah, you might actually look older, right? Because you're so dry and flaky. Well, Dr. Chang, this has been super informative. I've learned a lot, and I always love talking with my derm colleagues about a product that I just can't say enough great things about. I know people are going to want to find you and follow you. What's the best way for them to do that?
Absolutely. Yeah. It was great to speak with you too. I do enjoy speaking with colleagues as well because as I work alone, it really, it's nice to connect with other dermatologists and it's nice to know that we're all on the same page about important subjects such as, retinoids. You can find me on social media, Dr. Caroline Chang. Also, my office social media page is RI Derm Institute. I am a dermatologist practicing in East Greenwich, Rhode Island. My office is called Rhode Island Dermatology Institute, and I do medical and cosmetic dermatology there. It's a micro practice, so it's me seeing patients and checking you in, and I love it.
Yeah, and super direct access to you and no middleman insurance companies dictating. So, really cool and amazing work that you're doing. I will include all that in the show notes. And thank you so much for being here. And I'll see everyone next week.